teeth can heal, but the healing of the tooth comes from the superfluids.
Hello, welcome back. Are you curious about what Dr. Barbara just shared? Be sure to watch until the end of the video to find out the details. In this video, we'll listen to Dr. Barbara's insights on oral health and get valuable advice on choosing foods that benefit your dental health. Enjoy watching.
Teeth are the only exposed bones in the body, and just as if a bone breaks, it'll heal.
The insights Dr. Barbara is about to share come from her research and understanding gained through the book Holistic Dental Care, The Complete Guide to Healthy Teeth and Gums by Nadine Artemis. The book provides essential guidance for comprehensive oral health. The author offers safe and effective methods for oral care through natural approaches and reveals steps for at-home dental care that anyone can implement. This book will help you make wise decisions to maintain your oral health, and it is one of Nadine Artemis's bestsellers. You can find it on e-commerce platforms or in bookstores. Now let's move on to the main content of this video.
But she goes a little bit further with the teeth, which are the only exposed bone in our body, and they should not be deteriorating. And if they do have a little decay, they have the ability to heal themselves, as every other body tissue does. So why aren't they healing? Maybe they haven't been given the right times, or they have not been given the right conditions. And she calls these two superfluids. So what are your two superfluids? And these two superfluids are constantly bathing the teeth and nourishing the teeth. One is the internal. So the internal fluid would be your blood and your lymph. And remember what the lymph does, it sweeps away waste from the tissues. And remember what the blood does, it comes along with the nutrition, it comes along with the oxygen, it comes along with the water, the white blood cells. So this internal fluid is bathing from the inside. And your external fluid is your saliva. Now both the internal fluid and the external fluid, their quality is totally dependent on fresh air, sunshine, not taking anything in that will harm it, going to bed early, exercising every day, having a nourishing diet, having food that has the quality, the ingredients to build a healthy body, drinking adequate water. If you don't drink adequate water, that saliva does not have the ability to bathe, soothe, nourish and heal. When you look after your bones, you are also looking after your teeth.
The lymphatic system has a significant connection to oral health, with a mutually supportive relationship between the two. Improper oral hygiene can lead to mouth infections that spread through the lymphatic system. Lymph nodes in the neck are among the first to respond to oral infections. Conversely, a healthy lymphatic system can help control oral health conditions by fighting bacteria, viruses, and pathogens in the mouth. Swollen lymph nodes in the neck may indicate a dental infection, as bacteria entering the lymphatic system cause nearby lymph nodes to work overtime to combat the infection, leading to swelling. As for the external fluid, saliva, it plays an essential role in protecting tooth health. Saliva contains proteins that strengthen teeth and limit bacteria, along with minerals that reduce the risk of cavities and gum disease. Additionally, it helps prevent bad breath by controlling bacterial growth. Taking care of mental health is also an important step in supporting oral health.
Spiritual, emotional, and mental aspects of disease. Stress inhibits healing. Stress, worry, anxiety interrupts with all body processes, and I think that's not a surprise to anyone. So we need to be sure that our internal and external fluids are of the top quality to allow our teeth to heal. But something else is causing teeth to deteriorate, and that is food caught between the teeth. As one dentist said, only floss the teeth that you want to keep.
According to research, psychological disorders such as insomnia, stress, anxiety, or depression can lead to oral health issues like tooth decay, periodontal disease, and, in more severe cases, oral cancer. Therefore, maintaining a healthy mind and spirit is crucial for taking care of oral health.
Well, when food is caught between the teeth, it basically starts to rot. So what happens then is what causes it to rot is in that moist environment, you've got so many microbes in your mouth, they're coming along to clean it up. And as the bacteria and the yeast start to break down that food between the teeth, they give off a waste, and that waste has the ability to start eating away at the enamel on the teeth.
After eating, leftover food particles stuck between teeth can cause bad breath if not removed. You can use dental floss or a water flosser to remove these particles effectively and easily. Dental floss is particularly good for removing plaque between teeth, helping to prevent yellowing and keeping teeth white and bright. Furthermore, the long-term benefits of flossing include preventing cavities, gingivitis, and gum recession, promoting overall oral health. On the other hand, a water flosser uses water pressure directed at the spaces between teeth and gums to dislodge food, helping to prevent tartar buildup and bacterial deposits that can cause cavities. Both dental floss and water flossers are easily accessible, though dental floss is generally more affordable than water flossers. Besides using floss, adding a mouth rinse after meals can further enhance oral hygiene.
So make sure after every meal you rinse your mouth. Rinse your mouth very well. You can rinse it with seawater. You can rinse it with a mixture of sodium bicarbonate water and floss those teeth. Keep them clean, especially before you go to sleep at night, because by morning, wow, those microorganisms have had a party in there. And they've been able to have a lot of food in between those teeth, and they also have the ability to damage those the dentine that covers the teeth. So very important to rinse, very important to floss. In fact, both of these are even more important than cleaning with a toothbrush.
Mouth rinsing is also a crucial step in maintaining oral health. Rinsing after meals can help remove any remaining food particles. Furthermore, this habit reduces the impact of acids on the teeth, helping to neutralize the pH level in the mouth.
So oil pulling is using coconut oil. It's putting the oil in your mouth and it's swishing. Swish, swish. You might swish for 10, rest for 10, swish for 10 seconds, rest for 10 seconds. It's called oil pulling because it can pull waste out of the tongue, it can pull waste out of the glands under the tongue, it can pull waste out of the blood vessels under the tongue, and then you release that oil out on the grass. Don't release it down the plug hole or you'll plug up your plumbing. And take some water with you and rinse again and release that out. Teeth should not be deteriorating. And remember, if you have a little bit of decay, then it's important that you rinse and floss after every meal, that you oil pull maybe a couple of times a day. Just be mindful that keeping that mouth clean will prevent tooth decay and also encourage tooth healing.
Many studies worldwide indicate that lauric acid found in coconut oil has antibacterial and anti-inflammatory properties, helping to prevent the growth of harmful bacteria in the mouth. Additionally, minerals and vitamins such as vitamin E, iron, magnesium, and calcium are beneficial for oral health. Oil pulling is a process where you swish coconut oil in your mouth and around your teeth to support the health of your teeth, gums, and oral cavity. One study showed that oil pulling with coconut oil significantly reduces S. mutans bacteria. To try coconut oil pulling, you can follow these steps. Place a tablespoon of coconut oil in your mouth, swish it around for about 15-20 minutes, pushing and pulling it through your teeth. Then spit out the oil and brush your teeth. So what is the best way to heal your teeth? Stay tuned for Dr. Barbara's insights coming up next.
But the healing of the tooth comes from the superfluids, the internal blood and lymph, and the external fluid. Their quality is totally dependent on the food you're eating, how much you're drinking, going to bed early, so all of these things.
So which foods are beneficial and which are harmful to your oral health? First, let's take a look at the types of foods that can harm your teeth.
Sugar is one of the worst because you know what sugar does? It just feeds all those little microbes that are breaking down the things that are caught between your teeth. So those sugary drinks are particularly damaging to the teeth.
Sugar and sugary foods have a negative impact on your oral health. Sweets like candies and pastries cling to the spaces between teeth and to tooth surfaces, taking a long time to dissolve. Bacteria in the mouth consume this sugar and convert it into acid, which erodes and weakens enamel. Foods rich in starch and carbonated drinks are also harmful to your teeth. In addition to containing high amounts of sugar, most soft drinks have phosphoric and citric acids that erode enamel, making it easier for bacteria to produce even more acid. So which foods should we consume to protect and prevent oral health issues?
One of the best things to eat is an apple. Your teeth and your mouth need crunchy things. So with a refined diet today, there's hardly any crunch, have you noticed? But apples require you to crunch, and when you crunch, that is strengthening the teeth, it is strengthening the jaws, it is strengthening the gums. No wonder the old saying says an apple a day keeps the doctor away. So get used to crunchy things.
Apples contain malic acid, which helps increase saliva production and remove stains, as well as acid from food particles on teeth, preventing bacteria that cause bad breath. In addition to apples, other fruits like oranges, pears, watermelon, cranberries, and pineapple are also beneficial for oral health. Oranges contain compounds such as tannins, terpenoids, and flavonoids, which combat harmful bacteria in the mouth. Pears are rich in fiber, vitamin C, vitamin E, and water, all of which help clean teeth and maintain better oral health. Watermelon contains lycopene, a substance that helps prevent various oral diseases, including mouth cancer and gum inflammation. Polyphenols in cranberries play an essential role in fighting gum diseases, such as periodontitis. Bromelain, a powerful protein-digesting enzyme found in pineapple, also has anti-inflammatory properties that benefit gum health.
Every day we should have salad. So at lunchtime we always have a salad.
Dark leafy greens such as spinach, kale, and Swiss chard are rich in vitamin C, vitamin K, and calcium. Vitamin C helps strengthen the immune system and has anti-inflammatory properties that prevent gum disease. Vitamin K plays an essential role in reinforcing bones and gums, while calcium strengthens bones and teeth.
Celery is particularly good, and carrots at crunching it in the mouth. Children love raw carrots. Cucumbers, all of those crunchy foods, they're strengthening the gums, strengthening the teeth, and they are also strengthening the jaws. This explains why breastfeeding is so important for children, for babies, because when babies breastfeed, it takes a lot of work to get the milk out of the breast, but that hard work that the baby does, it strengthens the jaw, it causes the roof of the mouth to form properly with that tongue pressing against it, and it gets that jaw ready for the teeth to come through.
Celery and other crunchy, fibrous vegetables are beneficial for oral health. The fiber in celery helps remove plaque and food particles from the teeth. Carrots are high in vitamin A, vitamin B6, biotin, and fiber while being low in fat. Additionally, due to their hard texture, they are very good for teeth. Carrots are low in sugar, and their structure helps remove plaque as you chew. The jawbone is an essential part of facial structure, affecting the aesthetics of your smile and face. It also plays a crucial role in the chewing process. Thus, shaping and maintaining a healthy jawbone is an important step in dental care. Caring for oral health extends beyond daily brushing. Diet and lifestyle habits also play a significant role. It's essential to research and make informed choices about food and methods to protect your teeth from disease. If you found this video helpful, don't forget to like, share, subscribe, and tap the bell icon to receive notifications when our latest videos are uploaded. Thanks for watching.